Hi, I'm Dr. Brian Roadhouse. Anemia. A lot of patients are going to go to their doctor, they're going to have all the blood tests done, and maybe the anemia doesn't show up on the blood work. And it's just like any other test that you do, there's functional ranges, So if we're checking a patient for anemia, we want to have their lab values right here, not by the edge. If it's by the edge, common sense has to prevail that it doesn't work as good here as it is in the middle. So when a patient comes in with a chronic problem, anemia is very, very important. Why? Because each red blood cell carries 4 oxygen. What does the brain need to survive? Fuel. Fuel comes in the form of oxygen and glucose from the good food that you eat. And then its activation means that you need to use your brain. You've probably heard that we don't use all of our brain. You've probably heard the saying, you don't use it, you lose it. That's part of the brain. So when a patient comes in and they have a chronic condition, we want to look at anemia, because if you don't have normal red blood cell function, if you have an anemic situation, you are basically starving your body and your brain of oxygen. So that's why when patients come in here and we do the neurological treatments on them, we put them on oxygen. We use this thing right here, which is a pulse ox. We have different ones out there. We check their oxygen saturation rate, how much oxygen is in blood, and then we check the tissue perfusion. And that is how much of that oxygen that was in the blood is actually getting the tissues. If it's not enough, you can't heal. So anemia is huge. It's just one thing, but most of these patients have several things. That's why we do the testing. That's why we do the evaluation and look at it from the functional lab values. So, if you have a chronic condition, this is just another bit of information to hopefully help you make a decision on which way you want to go with your health care.